meeting of the Panhandle Health District. First thing on our agenda, I'm going to ask our secretary to call roll.
Chairman Thompson.
Here.
Vice Chairman Glenn Bailey. Bonner County at-large Representative Dr. Thomas Fletcher. Kootenai County Representative Dr. Jessica Jameson. Shoshone County Commissioner Tracy Cassidy.
Here.
Boundary County Representative Tim Bertling.
Here.
Kootenai County at-large Representative Dr. Duke Johnson.
Thank you. And we have no quorum at this point. A quorum will be an automatic thing as soon as a fourth board member either shows up in presence or on the screen. All right. I'd ask that we stand as we recite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. As is always on our agenda, we have a moment for a public comment session. Is there anyone here today for the purpose of taking advantage of a public comment? Anyone at all wishing to make a public comment? We allow 3 minutes for this, and we don't respond to this, but I hear no taker. We will move on. The consent agenda. Here we go. There's no quorum. This consent agenda, therefore, will be carried forward to our next meeting, along with whatever items that might show up between now and next meeting. All right, moving on then. Item 6. This is to report to you that the executive council here at the Panhandle Health District has taken, I believe it's a unanimous vote. Is that correct?
That's correct, Mr. Chairman.
All right, to discontinue our affiliation with FAB, the accreditation program that we have belonged to for the last, I don't know, 1 or 2 years. How many years, Kim?
5 years, Mr. Chairman.
5 years. Is that long?
Yes, sir.
Ooh. This will be, if you want to look at it financially, this will be a savings of $8,500. And if there's no objection from our board members, this will just be taken as a decision by the executive council to cease belonging to this FAB. Information, now there will be only one health district 2 out of Lewiston, that will be a member of FAB, if indeed they still are continuing to be with FAB. Any questions? Okay. We will move on. Item number 7, the Executive Council Trustee Report is Glenn Bailey. Obviously, you know he isn't here today, so no report. Now we get down to the important stuff. And we have our own Kim Young here today. And just like that, we're going to call on Kim to introduce our guest speaker. Kim, you have the floor.
Mr. Chairman. Well, today I have the pleasure to introduce Danielle Ballard. She is a fellow dietitian and our program manager over nutrition services. So that encompasses WIC, Women, Infants, and Children, as well as our diabetes programs. She is also a certified diabetes education specialist. I don't think I even said that correctly, but she's certified to educate our diabetes patients. And so she has really helped carry the diabetes programs forward. So with that, I'm going to let her talk about the successes that are going on in nutrition services.
Thank you.
All right. Thank you so much for that introduction. It's my pleasure to give a review of our programs. We do have those 4 nutrition programs, and I'll go through each one, just more highlighting the successes over the past couple years and some of the growth points. So our major program that we have in nutrition services is WIC. And we have seen some wonderful, consistent, and gradual growth over the past couple years. In 2021, we averaged about 2,800 clients participating each month. 2022, it jumped to 2,900, and this year we're up over 3,000. So it's been steady, about 3% each year growing, which is quite remarkable when you think about the pandemic and the remote services we were in for a couple years. And we are back to in-person, and it's been a joy to have screaming children in the hallways and our staff fully immersed in helping these clients get enrolled. So we serve the 5 counties. We have 5 offices, Kellogg's, St. Mary's, Bonners Ferry, Sandpoint, and our hub in Hayden. We did have an office in Post Falls, but we absorbed that into our Hayden office as it suited the clientele and our offices best at the time, just given the circumstances and the space. Our staff is relatively new in the past couple years. There was a lot of turnover during pandemic. So most of our staff has come on board recently, including myself. And we have 8 CSRs, or customer service reps. And we have 2 dietitians. One we just hired to be supervisory over the CSRs, and one is our coordinator over our breastfeeding promotion and lactation and peer counseling program, which we'll talk about in just a little bit. Fabulous staff. They all, to me, seem to have come on board for the right reasons, really trying to serve the population and a need to be involved in public health. So it's been great bringing in these new staff. Our hours of operation, we just this summer started later hours in the evenings for Wednesdays and Thursdays. We launched a customer satisfaction survey this past year, and it's been gaining traction, giving us feedback as to what our customers need. And one was hours outside the typical 8 to 5 for our working moms and dads who couldn't seem to get here during those time slots. So those slots have been filled and filled out into the next couple 3 months. They're being used well. I have to say we tried it last year, and the no-show rate, they just weren't showing up, but they are now. So it's been successful, and it's really nice to see some comments coming in and other ways that we can continue to serve these clients. We had a wonderful grant success this year. Our most recent dietitian hired, Jordan, fresh out of grad school with a penchant for WIC right off the bat. It's wonderful to see. She's going after her lactation consulting credential and very motivated. And she spotted a grant at a conference she attended this summer. And it had to do with providing our clients with prenatal vitamins who need them and couldn't afford them. District 2 actually has been doing this for years, but we didn't know about it. And she spotted the grant opportunity and applied for it and got it. And last month, she received 750 bottles of prenatal vitamins to hand out to our clients who can't afford them and are determined to be of the population that needs them, breastfeeding and pregnant. And coincidentally, our Merriman WIC coordinator reached out to us and was hoping to jump in on that. And we started networking with her and are now providing her some of those resources as well with the approval from our grant provider. So it's been something we've all taken pride in this year. And with that, I thought I'd like to read a couple customer stories to you. I was going to share them next month at the all staff meeting, but two of them are directly from our CSR's viewpoint, and they hit home for me, and I hope you'll appreciate them. The first one is from one of our CSRs up in Bonners Ferry. And here she writes, last month, a client was referred to our office from the local Victim Aid Services office. The woman's husband was abusive, and after an altercation, he burned their home down. The client had recently given birth and was starting a new job the next week. Due to the stress of the situation, her milk supply dried up. Her newborn baby needed formula. During the appointment, I was able to certify her newborn, and her other WIC-eligible toddler. I was able to give them a referral to parents as teachers, help her complete a Medicaid and SNAP application, and get her information to enroll her toddler in Head Start. I also provided her with a county resource list, which she was able to use to find several other support services, including free diapers and clothing for herself and her kids. Her appointment took a little longer than normal because she was still processing what had happened in the last 3 months. While I was able to give her a few nutrition tips, most of the appointment time was spent listening to her share her story and giving her a shoulder to cry on. I saw her recently in the grocery store, and she gave me a huge hug and told me she was shopping with her WIC card and that her SNAP application was approved. She said she was so thankful for her services we had provided her and her kids for the WIC program. Here's a second quick story from St. Mary's. A young mom was struggling with her 3-year-old and was very upset with WIC on the phone due to struggles to get scheduled. She lived in a place that had no connectivity. Phone coverage was spotty. Understandably, our CSR was very worried how the appointment would go when she showed up. Upon arrival, mom was very standoffish and then just broke down crying. She was overwhelmed. The child's behavior as he started annihilating my office was out of control. He was running up and down the stairs, running out of the office, and when she'd go to retrieve him, he would go completely limp and hang by his arm. She brought him back into the office. She reported her son is not very verbal, takes risks, doesn't listen, makes very little eye contact. During the visit, I found out Dad had a heat stroke that summer from being dehydrated, and as a result, Gatorade was being drunk in the house 24/7 and provided to her toddler. I advised mom to substitute water just to try it and avoid the sugary drinks, maybe the sensitivity to dyes. Mom listened, called a week later, and left a brief message to say that since she made these changes, her son's behavior completely changed. Upon calling her back, she ended the conversation with, "Thank you, my dear." St. Mary's. Pretty cool. Let's go to next slide. The other program that we have connected with WIC is our breastfeeding promotion and counseling, peer counseling program. 95% of our pregnant clients choose to breastfeed. That's huge. We get about 225 clients every month that are pregnant. Idaho ranked 5th top WIC state agency with the highest fully breastfeeding rates in fiscal year 2021. PhD was honored last summer with a breastfeeding award of excellence due to being ranked 1st in the state for fully breastfeeding clients. We have an awesome staff, and it does include our dietitian, who is the certified lactation consultant. She has 3 peer counselors, Peer counselors are prior WIC clients, and they are hired because of that. That makes them a peer to whoever's coming in and shows them how to pursue with success breastfeeding. And if they become more, they have more struggles, they're ratcheted up to the lactation consultant who helps them further. But so we have that staff in place. A grant was also funded this year to our breastfeeding coordinator, who applied to get 2 more staff credentialed in lactation consulting, which is quite costly, takes a lot of training, a lot of hours, and that's all been funded because of this grant. There's 2 classes that come out of this team. One is the Mommy to Be. It's in collaboration with our dental health program, and it's a full hour for brand new moms who are pregnant. A little about dental health, a little bit about nutrition, and a bit about breastfeeding promotion, and it's going quite well. That was our big project last year, is to get that moving, successful, and attended, and it is. We launched another one this year for a prenatal breastfeeding, a full hour just on breastfeeding. And that one's just lifting off the ground. So we're hoping to get that one flying pretty quick here. And one success story from this program, I have a peer counselor who sent this to me. I have a new young mom. She was very shy and nervous about breastfeeding. She started out with lots of doubts, questions, what ifs. The new mom attended an in-person breastfeeding class with me. She reached out for latch appointments, messages for support, and we developed a very well-rounded connection. This mom struggled with her milk supply from the beginning. She's received a lot of misinformation that triggered her to reach out. She fought for 5 months to breastfeed her baby. She's diligent, she's determined. I've been able to counsel her about her milk supply, help get her the resources she needed to get her daughter's tongue ties and lip ties revised. This mom was able to lean on our program and get the confidence she needed to breastfeed in public, pump at work, and advocate for her baby. She's mentioned multiple times that she's grateful for us and doesn't think she would have been able to keep breastfeeding if she didn't have this support. Next slide, please. Thank you. Okay, our third program we have is diabetes education. This was actually started back in 2020, might have been building up data in 2019 thanks to Kim. She got us recognized by the American Diabetic Education Specialist Group. And we were able this summer to achieve recognition with the American Diabetes Association as well. So we've got both going. And we pursued that because of the marketing platform. They're a very strong marketer. Online Kate has helped me with that as well quite a bit. But it allows us, at the time, it allowed us to get more insurance reimbursement. Thankfully, Idaho kicked in and started reimbursing Medicaid for both of those recognition states this year, just this summer. It was a big development. So with that said, we just got a new grant to help us fund the clients that come in with no insurance, because now we know we can get the Medicare clients reimbursed, we can get the Medicaid clients reimbursed. Commercial payers will typically pay, but we got the grant to cover those that are lining up with the social determinants of health, which is a very seems to be popular point for CDC this year. We have close to 50 referrals in the last 8 months. When I got here for 12 months running, we couldn't break 30. We're up to 50 just in the first part of the year, which is very exciting for us. We're developing partnerships with various organizations and providers across all 5 counties. We have a diabetes educator servicing that crew, including myself. I'm his backup, but he's the champ. He's a dietitian, and he got his certification this summer with putting in all those hours. And now he's meeting with clients in groups and one-to-ones. And he also heads up our diabetes prevention grant as well. So his name's Levi, and I hope you'll hear more about him soon. Let's see. And I think I mentioned we do one-to-ones for clients as well as groups for new diagnoses for diabetes. And I'll share one story for him. He sent me this one. One of the most influential clients I had the opportunity to serve has just been released from the hospital and was in critical need of guidance and support in managing her diabetes. And I believe this client was in Shoshone. Her proactive approach in seeking out our program spoke volumes to me, and I knew we had to help. This involved establishing a new family medicine partnership in Shoshone County, navigating through all the billing issues, overcoming her change of job, loss of insurance, even before being able to sit down for a first consultation. And although weight loss is a priority for many of my clients, including herself, it isn't the only measure of positive change. The positive for her included feeling better, having more energy, decreasing her stress load, meeting realistic and sustainable activity goals, drinking water, focusing on healthy substitution at meals. While there's a lot of progress yet to make, she's already come very far. As we sit down, she always starts off by saying how amazing PhD is for the programs we provide. She reports passing this on within her community, her coworkers, and friends. This rang true when I received another referral from her same provider based off her recommendation, and how she raves about the diabetes education program every time she sees her doctor. It's not always about the masses as much as it is about the impact you have on that one person, especially when we encounter the low-income rural areas that we're serving that don't have the resources we're accustomed to. All right, last slide, diabetes prevention. I don't have a story, so I won't hold you captive much longer, I swear. All right, we are the only diabetes prevention program in North Idaho, so that's quite a feather in our cap. It's something we really try to market, and we're trying to market with a lot of our providers. I think one of the big barriers we run into is not knowing that a lot of the providers are still getting accustomed to knowing what diabetes prevention is and how it's different from diabetes education. So with that said, we have done quite well this year. We started the year with 3 cohorts, 2 in Bonners Ferry, 1 in Sandpoint. We just started one in St. Mary's this week, and we plan to start another one in Hayden next month. So that brings us to 5 cohorts running. It is a year-long program. It's quite a commitment. It's 22 to 26 sessions. They're an hour each time with a peer-led group. Peer-led, I shouldn't say that, with a group of peers, which creates a comfort level for the client. Being in a group of peers versus showing up to a bunch of strangers has been something our clients have spoken to at the end of the program. We found that several of them show up and they always seem to know each other. These small towns, it's great. And we have 5 trained life coaches, and these certified life coaches teach the classes. And that does include Kim and myself and Levi, and then we've got 2 more that we access as needed and are currently training. I think that covers it. So that's my summary.
Well, thank you. Are there questions for Danielle? My comment is that I'll talk to Mr. Duffy about this. We probably need to hear more about what's going on with the diabetic program. And a lot of us deal with it directly or indirectly.
Yeah. Well,
Sure. Well, any other comments? I can say this, the love for your work and love of your work radiates from your countenance.
oh, thank you so much, Mr. Chairman. It would be my pleasure to give you more detail in the future.
Yes.
Just let me know. Thank you.
Sure.
Yeah, I appreciate the opportunity.
Thank you. Thank you so much. Well, all of a sudden, our entire meeting is made worthwhile by your presentation.
Stop, you're making me blush.
Well, I didn't mean to scare her off. Okay, well, a regular on our agenda every meeting, Christine. And you have the floor Though your report may be abbreviated, tell us what you have to share with us today.
Thank you, Mr. Chairman. Mr. Duffy had requested an update be provided on Luma, the software conversion implemented by the state, which was effective July 1st. So a bit of background, we did do a brief presentation on this several months ago, but the legacy system was old, 1987, 1988. It had reached its end of its lifespan. So the state researched commercial ERP systems and selected a system called Infra Cloud Suite as their ERP system. And ERP is an enterprise resource planning system which integrates all types of modules: finance, purchasing, human resources, and payroll, all into one system, making it much more efficient. And at one of our prior meetings, when we were discussing this, someone had asked why it was named Luma, because the state has chosen to call the new system Luma. And Luma comes from the Latin word lumen, to make clear or to shine a light on. I'm not sure how they came up with it, but that's the background of the name Luma. The fiscal benefits that we hope to achieve in this new conversion will be, and this also applies to the payroll and human resource side, is efficiency, because everything is integrated. Once it's entered, then it doesn't have to be entered into some type of secondary system, avoiding rekeying and the potential for error. It also provides the employees real-time information. Once it's in there, the system updates. I believe it's about every 20 minutes, every 30 minutes, making that information visible to staff. So program managers who are wondering what their expenses are can actually go in and see current real-time information. We're also currently seeing efficiencies in the workflow. Before, when a purchase request was initiated, it was a paper request. So the individual making the request had to get the signature of their supervisor. From the supervisor, if it went over a certain dollar amount, it had to go to another level of approval. This is all done electronically now, so we don't have to be shuffling paper throughout the building. And the other nice thing about the system is it's accessible by any mobile device. So if someone is out of the office, they can access the system and do an approval or update a timesheet. It also will provide, when we get there, we're not quite there, robust reporting. So we should be able to download volumes of data and be able to manipulate that data and provide any type of report needed. And it should also help with auditability. Eliminating the need to pull physical documents for audit or pull documents, scan them, set up individual files to provide samples to the auditors. Typically what happens in an ERP system is you give your auditors access to the system and they go find what they need. So that should also be an increase in efficiency. On the personnel human resource side, it will be advantageous and efficient to the employees because they can update and manage their own employee benefits. If they want to make a change in a 401k, they can do that themselves. And they will also have visibility to real-time personal time off. They won't have to wait for a cycle to close, a payroll cycle to close, to see what their leave balance is. As soon as they enter, when they anticipate taking time off, that information, current information, updated information becomes available. And again, all accessible by mobile devices. We are experiencing challenges, which would be expected with a major computer conversion, especially when you go from the 1980s to basically an old DOS system to an ERP system, 35, 38 years later, and you haven't had anything in between. we are experiencing some challenges, which were expected. And I will just highlight several challenges. It's not an all-inclusive list. We will be needing to rebuild reports. Previously, reports were provided by the state. Now we need to rebuild our reports. So we're currently in the process of doing that with the data that is currently available. Part of the challenge in doing that is the state is not updating what they're calling data cubes in a portion of the system that we use called Cognos, which allows us to download volumes of data to build our reports. They're not updating on a regular basis yet. They're also experiencing challenges. We're also going to be needing to update and or create new processes and procedures because total processes have changed from a paper system to an electronic system. The other thing that we have recently experienced is we have lost one of our senior fiscal staff members to retirement. She was with us for 17 years. A volume of institutional knowledge went out the door with her. So we are experiencing that loss as we make this conversion. And also with Luma, the billing module as it relates to projects and grants is very complicated. Large learning curve. We're making progress. We're making good progress. In fact, I would say in a number of instances here, we are ahead of other districts and other agencies. And we're also struggling with the cash management side of things due to the state not updating information on a regular basis. So that is a list of some challenges that we are experiencing. But in summary, we are making progress. We're making successful progress, although it's slow. And I would attribute that success to the entire PhD staff. They've been very open, very receptive, very willing to ask questions and seek out help. The other thing I would attribute our potential success to is the fiscal team. The fiscal team is excellent. They're very dedicated, very focused, and I'm very grateful that Dawn approved the temporary hire of an individual who had prior ERP implementation experience. And I believe that put us far further out in front than some of the other agencies. With her experience, she knew the potential pitfalls that we could encounter. So she had the ability to think forward and plan and respond to any problems that we might have. So that is the update on the Luma implementation. Any questions on Luma?
Who am I to ask questions when you're still figuring things out? Thank you, though.
If there are no questions on Luma, Mr. Chairman, I would like to make a side note, also requested by Mr. Duffy, on the update on the stolen Crosstrek that we did recover. The Crosstrek was stolen in October of 2022, was recovered, and the individual who stole the vehicle pled guilty on September 5th for the crime of grand theft. So he will be in custody for a determinate period of 5 years, followed by an indeterminate period of custody of up to 7 years for a total unified sentence not to exceed 12 years. And he was ordered to pay restitution of $776. So that's the update on the Crosstrek.
Wow.
If there are no further questions, that's my update.
That just boggles me to think that if every car theft could be treated in that manner, it would to me, it would put the kibosh on any enthusiasm over stealing cars. Any other questions, comments? Tracy? Tim, you still with us? That's good. All right. Thank you. And as you are aware, we aren't getting a full finance report this month, but look out in the future. Thank you, Christine, for your hard work.
Thank you, Mr. Chairman.
I love your word, experiencing challenges.
As a result of that, Mr. Chairman, we, the district staff, are also experiencing challenges related to Luma, not just fiscal. We've all felt the pain in some way.
All right, that's the day and age in which we live. And I will be forever behind. Mr. Duffy, how would you like to have the floor and try to compete with all of this for these lovely ladies?
Well, I failed on the outset, but I'll give it a try. Thank you, Mr. Chairman. Just a couple of updates for all of us here. And again, thank you, Commissioners Bertling and Cassidy, for being with us here today. I truly appreciate your attendance. And of course, you as well, Mr. Chairman.
Yeah, but you expected that anyhow.
Yes, that's for sure. So just a couple of updates on some good things happening here within the Health District. With the help of Kim Young and Jessica, we have arranged several meetings with superintendents of schools throughout the 5 counties. And they have been enthusiastic to meet with us when we talk about drug abuse within their schools, specifically relating to fentanyl and methamphetamine use. So we are arranging meetings with all of these superintendents to present to them some programs that would be easily implemented within their schools to prevent the use of these drugs. And this is all being funded as part of our our opioid settlement funds that we've received. And so we're excited to get that into the schools. We're excited to be doing prevention work at a young age. So more to come on that. We will be presenting what programs we might suggest to offer, but we're leaving that up to the schools to decide what programs they would like to use. We also are beginning to meet with our legislators. I've discussed this with you before. We had our first meeting today with Representative Jared Redmond. That went very well. Our hope is a couple of things. One, to make sure they're knowledgeable about the services happening at Panhandle Health District. And more importantly, getting their feedback on what they would like to see the health districts doing. So we'll give you more updates on that. Commissioners Bertling and Cassidy are already aware of this item C we have here. Just to let, Chairman, you aware also, we are seeing that remember that the state no longer is funding health districts, that remaining 19% of our budget is now fully funded by our counties. And yet we are seeing the state coming forward asking us to do tasks, which I'm calling unfunded mandates. That includes work in our harmful algae bloom work that we do, as well as asking us to start investigating and looking into kitchens at assisted living facilities, a task that currently is not part of the grant that we have with the state. We have been saying no on the second topic, but I'm just making you aware of that. And the problem that we have with that, even though both of those services are so very important, that if we are doing that without the necessary funds, that will be covered by our counties. And we're got our heels in the ground on that with the state. And I'm sure more will be coming. The 7 directors, we are talking about this frequently as well. So more to come on that. Also, every year we have our all-district staff meeting. Kate Hoyer and her team have done a wonderful job putting together our ADSM. That will be on October 5th. That will be at the fairgrounds this year in Building 3, and would invite any commissioners or any one of our board members to attend with us. We're very much looking forward to that day. We had our annual SPAN walk on September the 9th. I'm happy to say that we had a record number for the walk. We had over 436 people in attendance. And one of the interesting statistics with that is 70% of those that attended had suffered a loss by a loved one or friend to suicide. This continues to be an alarming problem, particularly in the state of Idaho. And so it was a wonderful event. We were able to collect over $11,000, and we will find a good home for that money. As you remember, last year we donated $10,000 to the Veteran Outreach Center in St. Mary's, Idaho. That's been a very wonderful service for veterans in that community. And finally, I've talked to a few of you. I would ask you to continue to ponder this, of whether or not we should consider a change in date and time of this board meeting, with the hopes that it is more convenient to all of our board members. And that could be a morning meeting. It could be the same. It could be a different day of the week, or even later in the afternoon. I know that all of our board members have very busy schedules, but we have not changed this for as long as I have been here. So wanted to throw that out there. And if you have any feedback, please give me a call, drop me an email, and we'll continue to discuss this at future meetings. One thing I failed to mention under our meeting with our legislators is our next Board of Health meeting will be November the 16th. And prior to that meeting will be our legislative update. That usually begins, as I recall, around 11 o'clock, where we invite all elected officials throughout the 5 counties to come to the health district to hear about Panhandle Health District, hear their questions and suggestions, and also provide lunch for them. So wanted to make sure you were aware of that. And are there any questions? If there are no questions, Mr. Chairman, that's the end of my report.
Thank you. And as you see your agenda, that also brings us down to the end of the agenda. One comment I failed to make earlier, we passed quickly over the consent agenda, but I do want to mention that I appreciate the division reports. Sometimes just the director, but I see that this task is being spread out among other people in that division, and I do appreciate receiving those reports. Would that we had enough time for more verbal reports at our meetings, but I do like the written reports. As Mr. Duffy has said, our next regular meeting is November 16, which is preceded by the legislative update. Again, Tim, thank you for putting forth the effort to be with us today, as also with you, Tracy. There's some of us, we're going to spend more time going and coming than we are staying. But is there anything else to come before this board at this time? If not, we are adjourned. Thank you.
Thank you. Thanks, Tim.
Your ability to operate a mouth parallel. We'll give you one.